everyone, welcome back. Today we are looking at a massive shift happening right now in healthcare. We all know AI can write emails and generate images, but what happens when an AI agent starts acting as your medical assistant?
It is a totally fascinating trend. Since early 2024, medical AI agents have absolutely exploded in China. But to be clear, right up front, they aren't replacing doctors just yet. What they are doing is radically changing how hospitals operate and how patients get treated.
So let's get into it. How exactly are these AI agents being used in the real world? Are we talking about diagnosing diseases on their own?
Not quite. Think of them more as ultra-smart assistants that operate in two main areas. The first is hospital efficiency. For example, at Zhongshan Hospital, they deployed an AI agent to write medical records. It literally cut the time doctors spend on paperwork for a patient from 20 minutes down to just 5 minutes.
Wow, saving 15 minutes per patient is huge. That must prevent so much doctor burnout. What about the patient side of things?
That is the second big area, expanding reach. AI is interacting with patients before they even step into a clinic. Take Dr. Mao Hongjing, a sleep disorder expert. He has an AI digital twin on an app, and over 1 million users have already consulted it. The AI asks all the background questions, assesses your insomnia, and preps the data. So when you finally see the real human doctor, he doesn't have to start from scratch and can just focus on the actual diagnosis and treatment.
Okay, saving time and doing pre-consultation sounds amazing on paper. But doctors must be feeling the heat. Are they worried about this tech taking over?
Their mindset is actually super complex right now. Some are embracing it, but others are deeply cautious. A top infectious disease expert named Dr. Zhang Wenhong actually pushed back hard. He warned that if young medical students rely on AI to give them the answers, they will never develop independent clinical thinking.
Right. If the AI makes a mistake down the line, a doctor who grew up using it might not even know how to spot the error.
Exactly. But on the flip side, tech founders argue that a doctor's learning curve shouldn't come at the cost of patient health. If AI can process data and spot a problem faster, the patient wins. But the hard truth is, these AI agents just aren't at the expert level yet.
Let's talk about those limitations then. How accurate are we actually talking when it comes to these AI health assessments?
It really varies, and they have a long way to go. For instance, there is an Alzheimer's screening agent called Rui-C that uses mini-games to test cognitive function. Right now, its accuracy compared to gold standard medical tests is only about 50 to 60%, though they are aggressively trying to reach 90%. And there is a real danger here too. A recent article in JAMA warned that patients might use these cheap, accessible AI tools to bypass real doctors entirely, which is incredibly risky.
That sounds like a regulatory nightmare waiting to happen. Who is keeping this in check? Can an AI legally prescribe me medicine right now?
Absolutely not. The regulations are drawing a very hard red line here. Under current laws, AI is strictly classified as an assistant. It cannot make the final diagnosis, and it is strictly forbidden from generating prescriptions. Every medical decision still has to be signed off by a licensed human doctor. As one industry CEO put it, safety has to be the absolute bottom line.
So AI gets us in the door faster and saves the doctors from drowning in paperwork, but the human touch still makes the final call. Really insightful stuff. Thanks for breaking down the logic for us today, and we will catch you all in the next episode.